I'm a very hands-on person with patient care, and I talk to the patients and I listen very carefully to what they tell me. And so I'll sometimes pick up on things that other people have not heard, and I will treat the patient based on that. Like, I'll listen very carefully when you talk to me about your mask and about your machine, and you will tell me, I just have a terribly dry mouth. And then I have to think of all of the things that might cause a dry mouth and what I can do to help you with your dry mouth. I am someone who does a lot of teaching with patients, and I use a lot of analogies like this is how fast the car goes and this is how strong your CPAP is, but I can bring it down to their level. So I take the science, I digest the science, and I bring it down to the patient's level so that they can understand it. And they're like, nobody ever told me that before. And I'm like, well, now you know. So, now you can do better because you know about these things. I have worked at SLU for forever, and I have been a nurse practitioner for over 20 years. I like working at SLU because of the science that is here, and it's always challenging. I don't see the garden variety patients, and I can get very personal with them, and they tell me things, and I can work with them and help them. And so it's not just a cookbook. It's a cookbook with a lot of additional ingredients added to it, and you have to work with all of those ingredients to get the best outcome for the patients.